Hi everybody. So I'm back for video number 2 on vitamin D. Yesterday's video regarding the benefits of vitamin D as well as the downsides of deficient vitamin D we talked about at length. So I thought I'd take a more practical approach today about how to correct a low vitamin D, how to assess if you need to correct a low vitamin D, and the ways of doing it. So vitamin D, as I mentioned, is a hormone in many ways. Unfortunately, it's not in a lot of foods. It is in cold water fish, so salmon, sardines, other type of fish. It's hard to get enough of it to actually supply it. A lot of foods are fortified with vitamin D. Unfortunately, those are foods that maybe we don't want to consume a lot of, things like milk and orange juice. So vitamin D is some of it. It will be absorbed through sunlight, but not much. So generally, everybody needs to take vitamin D, in my opinion. Now, to determine the dose, because it should be looked upon just like a hormone, so therefore, just like if you were on a thyroid replacement, you wouldn't just go pick up a thyroid pill. You would pick up a dose based on your body's needs, based on levels, maybe clinical symptoms, etc. So vitamin D is the same thing. So when you get a vitamin D level checked, based on what it is, I'll recommend a dose. Typically, most people will need 5,000 to 10,000 units daily in order to maintain doses, or excuse me, levels that I feel are adequate, between 50 and 70, as we spoke of yesterday. Certainly, there's no emergency if the levels are low, you can titrate up. So it's always based on levels. People that are a little heavier, have more body fat, have to take a higher dose. Vitamin D gets absorbed into the fat pads. People that have less body fat maybe take a little bit less. As I stated, you can theoretically become toxic, but it takes very, very high levels for long periods of time. So in the beginning, as long as you're titrating it up slowly, again, with my recommendations, if I am your physician, and if I'm not giving you advice here, I'm telling you to go speak to your physician, make sure your levels are being checked, and figure out the best way to replace vitamin D. Now, people always ask, what type of vitamin D? There's vitamin D, there's vitamin D2, there's vitamin D3. They're all generally the same. The different vitamins are the stages of vitamin metabolism to eventually get the active form, which is vitamin D3. Little do people know that you need actually 3 organs to produce active vitamin D. You need your skin, your kidneys, and your liver. All 3 organs will convert the building blocks of vitamin D into active vitamin D3. So it's easy to pick up vitamin D3. I recommend that all vitamin D3 that my patients take have something called vitamin K2 in the pill itself. The reason being is because with vitamin D, vitamin K2 will help metabolize calcium, meaning will help keep it in the bones and can actually help keep it out of blood vessels and out of arteries. So as I like to use an analogy, it's almost as if the vitamin D lassos the calcium that's in the bloodstream we're trying to get out, and the vitamin K2 helps to decide where it's going to go. So when it needs to be back in the bone, it's there. If it's in the arteries, it actually can help be removed from arteries with the help of vitamin K2. Again, a conversation for another time, but there's a lot of evidence for people that do have arteriosclerosis that taking vitamin K2 with their vitamin D can actually help slow down and even reverse some arteriosclerotic disease. So getting back, we talked yesterday, to go back to the video, that's why we have the library, talking about how important vitamin D levels are, just statistically. I'm not going to sit here and tell people that if your vitamin D levels are low, you're going to get cancer or heart disease or brain disease or autoimmune diseases, as I said yesterday, but I am saying that a low vitamin D level statistically will bring you more chance of everything I just mentioned, including a weak immune system. And we learned this the hard way during COVID. In the initial cohort a year or 2 ago, people were dying. A lot of it was from a weak immune system due to severe vitamin D deficiency, as well as other immune system weakening topics. So I hope this helps kind of round out the vitamin D issue. Again, I'm basing most of what I'm stating on evidence and statistics, clinical studies, meta-analyses looking at patient databases, and telling that unless there's a real contraindication that everybody should consider taking a vitamin D supplement, my patients will get my recommendations. If you are not my patient, please do not take this as medical recommendation. Please ask your doctor to measure your vitamin D level and then have a discussion regarding vitamin D replacement. Hope to see you in the next videos. Keep the comments coming. I appreciate it. And I am going to take, one patient said that we need to get some sort of a microphone that can make the sound of the video, maybe here so it doesn't echo in my office. We're going to keep trying to improve the videos. I have AJ come around. AJ, I want you to say hi to everybody. This is the brains behind the operation.
Hello.
And we're going to cut it for the weekend. Everybody enjoy, stay healthy and safe.